So I just received a report. Miss Betty Beddington is a 45-year-old female patient of Dr. Doctor. I'm getting ready to review the provider's orders and administer her needed medications. Throughout the video, I will be going over the 10 rights of medication administration, which is right medication, right client, the right dose, right time, the right route, right documentation, the right evaluation, the right reason indication, the right to refuse, and the right client education. So I'm gonna go ahead and begin, and I'm gonna go into my MAR, and I'm gonna look at the patient chart with what has been ordered by the provider and what's available at the Omnicell. So we have Betty Beddington of January 1st, 1967. Her current medical history is diabetes 2 and pneumonia. And the provider has ordered lisinopril 10 milligrams per mouth, 16 units subcutaneous of NPH insulin, 9 units of subcutaneous regular insulin, a tuberculin test, 0.1 milliliters intradermal, ampicillin 330 milligrams per mil intramuscular, morphine sulfate 15 milligrams intramuscular stat. I'm gonna call the provider and clarify on the morphine sulfate because he did order 2 of them. So I'm gonna call him. Yes, hello, Dr. Doctor. This is Ruby, and I'm here preparing some medications for Betty Beddington for pain and her regular morning meds. I just wanted to clarify on some medications that you had prescribed twice for morphine sulfate. I was looking at the drug reference book and I saw that the recommended dosage was 2 to 15 milligrams, and I just wanted to be sure that that was the correct one I needed to give, just because the other one is out of the recommended dosage. Is that correct? Yes, okay. So just to re-clarify, I will be giving morphine sulfate 15 milligrams intramuscular stat, correct? Okay, and I'll go ahead and cross out the other one, and if you could please go ahead and sign that as soon as possible. Okay, perfect. I'm gonna go ahead and prepare these and administer them. Okay, thank you. Have a good day. Okay, so I'm gonna go ahead and do my calculations first before I begin. So we have lisinopril. We have available are tablets. And we have 20 milligram tablets available. So we have 0.5, which is half a tablet. We have NPH insulin and regular. They want 16 units and 9 units, which is 25 units. Then we have a tuberculin test. And that's available in 0.1 mils, and so it's gonna be the same. We have ampicillin. The desired dose is 330 milligrams a mil. And available we have 1 gram in powder over 5 mils. So then we're gonna put So it's 1.65 rounded to 1.7 mils. Next we have morphine, 15 milligrams, and available we have 20. So rounded is 0.8 mils. And then I'm gonna show the math. Okay. I'm gonna go ahead and prepare this medication. So I'm gonna get out, lisinopril is 10 milligrams per mouth. We have half a tablet. I'm gonna go ahead and cut that up in the patient's room. We have insulin, NPH, and regular. While I'm doing this, I'm gonna do the first check for medication administration. I'm gonna check patient's name and date of birth and make sure I have the correct insulin and regular insulin. So next I have the tuberculosis test. I'm gonna do the same. I'm gonna provide the check, patient's name, date of birth, and the medication. I have the amoxicillin. I'm gonna have to reconstitute it. And so I'm gonna check the MAR and the patient chart just to double check I have the correct one. I have the morphine sulfate. I'm gonna go ahead and check once again in the MAR. I'm gonna get an insulin syringe for the insulin. I'm gonna get a TB syringe for the tuberculosis test. I'm gonna get two 3 milliliter syringes with, it could be 1 to 1.5 inch, 21 gauge for intramuscular for the amoxicillin, and then 1 3 milliliter and 1 inch for the morphine sulfate. So then once again, I'm gonna provide hand hygiene, put hand sanitizer, and I'm gonna put gloves on. And while I'm preparing after I'm done preparing the medication, I'm gonna provide my second medication administration check to make sure I have the right dose, the right time, the right route, and the right client, and the right medication, of course. So I'm gonna begin by getting some of these alcohol pads. So the lisinopril, I have to open it at the client's bedside. I'm gonna open the insulin syringe. Okay. And I'm gonna grab an alcohol swab. But first, before I begin, I'm gonna roll them, checking as well the expiration date and noting the color, making sure the vials have not been tampered with. I'm gonna open the cotton swab and I'm gonna clean it for at least 15 seconds. I'm gonna grab a new one. Being careful not to touch the top of the vial once it's been cleaned, as well cleaning it for 15 seconds. This one is asking for 16 units of NPH and 9 units of regular. So I'm gonna go ahead and pull back the 16 units of air to fill the NPH. Taking it out, being careful, then I'm gonna go ahead and put 9 units for the regular. And I'm gonna turn the vial, being careful not to touch. I'm gonna get 9 units of the regular insulin, making sure I don't get any air bubbles. I'm gonna grab from the regular insulin first, and then I'm gonna go into the NPH and do the same, being careful not to mix both. And I'm gonna go ahead and put 16 to equal out 25. And I'm gonna go ahead and put the cap back on. And I'll put those to the side and label them according to facility policy. I'm gonna go ahead and do the same for the TB test. We're gonna open it, we're gonna check nothing has been tampered with, the expiration date, the color. I'm gonna go ahead and grab a new alcohol swab, and we're gonna clean the top for 15 seconds, being careful not to touch the top of it. We're gonna open the TB syringe, and then I'm gonna pull back 0.1 mils of air, taking off the cap, injecting it, and then I'm gonna go ahead and turn the vial, and then getting 0.1. Being careful not to stab myself. I'll put that away and label it according to facility policy. I'm gonna go ahead and reconstitute the amoxicillin. So this one, we're gonna read it says 2.5 of dilution. We're gonna open it, making sure nothing has been tampered with. So I'm gonna clean the top of it for 5 seconds. 15 seconds, I mean. And then I'm gonna grab a new one and clean the top of it as well. So probably put it. Be careful not to touch it. If I touch it, I clean it with a new one. So I touched that one at the top. I'm gonna re-clean it. Okay. So now it calls for 2.5. So I would put 2.5 mils of air. I'm gonna take off the and place the air into it, and then I'm gonna grab the 2.5 of liquid. Making sure I don't have any air bubbles. I'm gonna go ahead and inject it. So then I close the cap and dispose of the needle. I'm gonna go ahead and mix it, making sure it's well evenly mixed. I think a little bit more. And then if I need to, because after rolling it, I probably touched it, I would grab a new alcohol and re-clean it to disinfect it. And I'm gonna go ahead and grab 1.7 mils, and I'm gonna fill with air. And I'm gonna go ahead and invert the vial, and don't want air. We're gonna grab one. And we're gonna grab something hard to not recap this, to take it to the client, to the patient. Lastly, I'm gonna do morphine sulfate. I'm gonna make sure the expiration date, nothing has been tampered with. I'm gonna grab a new alcohol swab, clean the top of it for 15 seconds. Being careful not to touch it. I'm gonna grab a 3 milliliter syringe with a 21 gauge by 1 inch needle. So we need 0.8 mils. I'm gonna draw back the air. Okay. And then I'm gonna go ahead and .8. Okay. Then we're gonna do the same. Be careful not to poke ourselves. Now that I'm done preparing the medication, I'm gonna label all the multi-dose vials according to facility policy. I'm gonna go ahead and perform the second medication check into the MAR. I'm gonna make sure I have the correct. So we have 10 milligrams of lisinopril. We have 25 units of insulin. We have 0.1 mils for the TB test. We have 1.7 mils of the amoxicillin, and we have 0.8 mils for the morphine. I'm gonna go ahead and clean all this up. One more thing I didn't check was the allergies of the patient in the MAR. I want to make sure they have no allergies, and they don't. So I'm gonna clean all this, put this away, take off my gloves, and go into the patient's room to administer these medications. So I'm gonna put this. We have a cup of water. We have bandages if we need it. I'm gonna take our MAR and our patient chart that's gonna be assessed over there. Okay, now we're gonna go to the patient's room. Hello, closed door, provide privacy. Hello, my name is Ruby, and I'm gonna be your student nurse today. Can I get your full name and date of birth? Betty Beddington, January 1st, 1967. Perfect. Hello, Betty. I'm here. I brought some medications that the doctor prescribed. On a scale of 1 to 10 from 1 being no pain and 10 being the worst pain. Can you rate your pain? A 9? Okay, I have some pain medication for that. I noticed in your chart that you had oxycodone and it didn't work, so we're going to be administering morphine today. I'm going to go ahead and check the MAR once again. I'm going to log in, check your name, date of birth, make sure we have. One question, Betty, do you have any allergies today? No allergies? Okay, perfect. We're going to go ahead and administer these medications, but before I do, I'm going to provide some client education on these medications just so you're aware of the side effects and what I'm going to be assessing for. So, lisinopril is an antihypertension medication. Possible side effects are nausea, dizziness. We're going to watch your blood glucose levels because they could drop. We have insulin, and it's a diabetic medication, and it's going to help decrease your glucose levels. And I noticed that one thing before I continue with insulin, one thing I forgot to mention that I saw on your record that your blood pressure was high, and it's going to help with your blood pressure as well. It's going to help it bring it down because it is high. Now insulin, some side effects for insulin, it could be just, it's going to bring them down to normal levels. And if you are feeling a little bit sick or you feel out of the normal that you're not supposed to, please let me know as soon as possible. The TB test is a routine test the doctor ordered just because you come in and out of, you travel from Mexico often. We just want to know if there's going to be no reaction or be positive to TB, to tuberculosis. Amoxicillin is an anti-infective medication, and it was prescribed by your provider for your pneumonia, and it's going to help with that. Some side effects of that is headaches, dizziness, nausea, respiratory distress. One severe reaction you could have is anaphylaxis, and it could be from swelling, hard of breathing, and that's if you have a severe allergic reaction. So I would need you to let me know if you do have any of those symptoms as soon as possible so they can be treated. The last medication is morphine, and it's an opioid analgesic, and it's for your pain. This will help bring down your pain level, and hopefully you won't feel any pain. Some side effects of that is confusion, dizziness, sedation, chest pain, cardiac arrest, respiratory distress. So if you do have any of those symptoms, please let me know. And of course, if you have any severe allergic reactions to where I place the injections, just because they're going to go intramuscular, I would like to know that as well. So I'm going to go ahead and assess my patient and get some vital signs before I administer these. So if it's okay, I'm going to go ahead and, I don't know if I provided hand hygiene. I'm going to hand hygiene. My gloves. Do you have any questions today on any of the medications? No questions? Okay. And I just want to let you know that you do have the right to refuse any of these medications that we are going to be administering today. So I'm going to go ahead and listen to your lungs. If you can please breathe every time I touch with my stethoscope. Okay, I'm going to go ahead and listen to your heart. Okay. Listen to the other side using the bell. Okay, I'm gonna go ahead and place the oxygen on your finger. I'm gonna check your pulse. And I'm gonna go ahead and check blood pressure on the other side of your, we don't have a cup, but I'll just place it. I'm gonna check your blood pressure, oxygen, check your pulse, I'll listen to your lungs, heart. Okay, perfect. I'm gonna keep the oxygen, no, I'm gonna go ahead and take it off. Looks like your blood pressure is a little bit elevated. I'm gonna take this off while I administer the medication. Here. Now I'm gonna go ahead and administer these medications. The first one we're gonna do is the Synapryl, and this one's by mouth. And you are okay swallowing pills, correct? Okay, perfect. So I'm gonna cut this pill because we only need half of it. And I'm gonna throw away the other half and I'm gonna clean that. So here's your water. Then I'm gonna go ahead and sit you up. Already sitting up. Is this a comfortable position for you? Perfect. Okay, I'm gonna go ahead and give you your medication. There's a cup of water. Okay, and then the water. Perfect. Was that okay? Did you swallow it? Okay, perfect. I'm gonna go ahead and I'm gonna do the TB test first just to get it out of the way. Do you have a preferred side you would like for me to administer? What side do you write with? With your right? Okay, I'm gonna go ahead and do it on your left. Okay. So we're gonna do this intradermally on your forearm. And I'm gonna go ahead and place it right here in the middle, and I'm gonna disinfect it. I'm gonna let that dry. Once it's dry, I'm gonna go ahead and insert with the bevel tip up at a 5 to 15 degree angle into the skin. Are you doing okay, Betty? Yes, okay. I'm gonna go ahead and insert the liquid, and it should make a little bubble. I'm gonna not place any pressure on it. We're gonna dispose of the needle accordingly. And we're gonna mark the area where I placed the mark. You should see some signs like a raised bubble, and it should go down. We're gonna monitor it for 48 to 72 hours, and if you do have a reaction, the doctor will probably order some x-rays to be done. Okay. So next, I'm gonna do the morphine, and the morphine is gonna go in your deltoid on your arm just because it's less liquid, and it's gonna go intramuscular as well. I'm gonna provide my supplies. I'm gonna sit you up. Okay. I'm gonna do the same thing. I'm gonna locate the chromium process about 2 fingers down. I'm right in the middle. So I'm gonna clean it, disinfect it. And just, I need you to relax your arm just so it doesn't hurt as much. And I'm gonna do the C-track method at a 90-degree angle. Using a dart light motion, I'm gonna let the medication 1 ml per 10 seconds. And I'm gonna leave the needle there for 10 seconds just to make sure the medication went in. I'm gonna take out the needle slowly and release and throw this in the correct disposable. Are you doing okay, Betty? Okay. 2 more and we're almost finished. We're gonna do this one on your stomach. If it's okay if I can uncover you. And for this one, we have to pinch the skin. And this one can go at a 45 to 90-degree angle. And just like all of them, the rest of them, I'm gonna disinfect the area. For this one, I'm gonna let it dry. And I'm gonna pinch the skin. And it can be a 45 or 90-degree angle. And slowly, 1 ml per 10 seconds as well. Leave it there for 10 seconds. And then pull out in the same angle that I went in. Okay. I'm gonna dispose of the needle. I'm gonna go ahead and grab my last one. This one's gonna go in your thigh. Just because it's a little bit more of a medication than the rest. For this, I'm gonna probably lay you back down just a little bit. And I'm gonna go ahead and cover you if that's all right. And for this one, we're gonna locate the greater trochanter and the medial condyle, and right in the middle. So right here. And we're gonna do the same. We're gonna disinfect. We're gonna let that dry. Make sure there's no air bubbles. Okay. We're gonna do the C-track method at a 90-degree angle using a dart light motion. I'm gonna slowly disperse. I'm gonna slowly at a ml per 10 seconds, leaving the needle in for 10 seconds, and then releasing the skin. Are you doing okay, Betty? That was our last one. Okay. Now I'm gonna go ahead and put the oxygen monitor on your finger once again, just to monitor your oxygen levels while I'm here. I'm gonna stay in the room for 15 to 30 minutes just to monitor how you're doing on morphine, since it is an opioid. I need to be monitoring your symptoms and making sure that nothing should show up. Okay, I'm gonna go ahead and take off my gloves, provide hand hygiene, and I'm gonna go into the medical record. I'm gonna document the dosage, the time, the route. The client didn't refuse any medications. I'm gonna make sure that I document everything, the vital signs that were done at the beginning, and I'm gonna be here if you have any symptoms, please let me know. So I document, then after that I just make sure 20 minutes pass. 15 minutes pass by, and I'm gonna go ahead and reevaluate Miss Betty Beddington. Okay, so while I'm here, did you have any of the symptoms that I mentioned with the medications? Are you doing okay? Okay, it looks like her oxygen level is normal. I'm gonna go ahead and check her blood pressure. So I place a cuff, and her blood pressure looks like it's going down, meaning lisinopril is starting to take effect. One question I have, Betty. Can you rate your pain on a scale of 1 to 10, with 1 being no pain and 10 being the worst pain you could possibly have? A 7? Okay, perfect. Your pain is starting to go down with the morphine that we administered. Do you have any questions for me? No questions? Okay. I'm gonna go ahead and leave this oxygen just to be checking you, just because we did administer the morphine, and I wanna continue evaluating how you are doing. So I'm gonna go ahead and document my vital signs. I got the pulse. I'm gonna go ahead and check the lungs and the heart before I forget. And if you could please breathe every time my stethoscope is touching your skin. Okay. So I'm gonna go ahead and document the vital signs. The patient had no reaction to it. I'm gonna go ahead and document what we did, making sure I have everything in the system. And I'm gonna go ahead and clean up and wash my hands, provide hand hygiene, and leave the room. Okay, Betty. That was everything for today. If you do have any issues, please, I'm gonna put your call line within reach, and please don't hesitate to let me know. Do you have any questions, concerns? No? Okay, perfect. I'm gonna go ahead and step out of the room. Thank you.